Hello, I'm here to talk about
Harvard School of Public Health Diabetes Study. Boosting your caffeine intake may lower the risk of diabetes. Scientists in the Harvard School of Public Health Diabetes Study say an increase in coffee intake can help lower the risk for adult-onset diabetes. People who boosted their coffee intake by moderate to large doses had a lower risk for adult-onset diabetes than those with stable consumption. Their studies tracked the diet and lifestyles of more than 120,000 health sector workers. Those who increased their daily caffeine dose by about 1.5 cups a day over a 4-year period had an 11% lower chance of developing type 2 diabetes. This was in comparison to those whose intake remained constant. Changes in coffee consumption habits. The boost in consumption appears to affect diabetes risk in a relatively short amount of time. This is the conclusion of the team led by Chilton Papiru of the Harvard School of Public Health in Boston. Those with the highest coffee consumption, 3 cups or more per day, had the lowest risk of type 2 diabetes. That is 37% lower than those who consumed a cup or less per day. The findings were based on monitoring more than 120,000 health sector workers, more than 95,000 women enrolled in 2 nurses' health studies, and nearly 28,000 male participants in a separate health professional study. It measured their consumption patterns for 4 years, and then looked at subsequent diagnoses of type 2 diabetes. The outcome may reflect a true change in risk. Ingredients: high blood pressure, elevated cholesterol associated with risk for type 2 diabetes. Experts analyzed the new research for the Science Media Center and say the team merely evaluated potential short-term benefits. There is no evidence that long-term coffee intake lowers diabetes risk. The research measured changes in consumption rather than absolute intake. So, who's right? Harvard or the Science Media Center? No contest if you ask me. Ready to boost your caffeine intake? Keep in mind, the facts are that caffeine in coffee has many effects. Most of them are healthy in moderation, that is less than 300 to 400 mg a day. There are certain people who should stay away from caffeine because of the risks that could possibly affect their health. These include minors, people with heart condition and caffeine intolerance, and pregnant women. Do not miss our next video, Caffeine-Loving Bacteria to Clean Caffeine-Polluted Wastewater, adapted from an article in the ACA journal, Synthetic Biology.
Thanks for watching. Please click the link in description for more information.